Hi, this is Dr. Arun Mukka, Endocrinologist at Yashoda Hospital. Often patients ask us, Doctor, will exercise prevent the development of diabetes? And even if I have developed diabetes, will the exercise be of any benefit to us? Let's try to understand that. It is very important to understand that the physical activity, exercise, can help in managing the diabetes in multiple ways. First of all, it helps in preventing the development of diabetes. Even if a person develops diabetes, physical activity helps in controlling or having a good blood sugar control in diabetic patients. And third thing is, even if a diabetic patient had developed complications like heart or kidney problems, physical activity helps in bringing down the burden of the complications. Let's try to understand one after the other. How is the exercise helpful in preventing the development of diabetes? Now, a simple exercise like walking for at least 30 minutes a day for at least 5 days a week, which means 150 minutes of physical activity, that is exercise or walking per week. The science has established that this amount of exercise per week is known to prevent the development of diabetes in 60% of the people, especially in the people who have a borderline diabetes, whom we call as having pre-diabetes. Now, if they resort to walking or having any kind of physical activity of at least 150 minutes per week, it is established by the science and it is proven by the science that this physical activity can prevent the development of diabetes by up to 60%. So, such is the importance of the exercise in preventing the development of diabetes. Now, exercise also helps in controlling or giving a blood sugar control to our diabetic patients. Now, how does it? Exercise actually sensitizes the body to the insulin. That is, for the same amount of the insulin which is present in the patient's body, it gives a better blood sugar control because the muscle gets sensitized to the presence of the insulin in the body. Lesser amount of insulin if it is present, it does a better job of giving a good blood sugar control, and so having a good blood sugar control in these patients translates into lesser complications in our diabetic patients. The medicines given to the diabetic patients work more effectively. The patients whom require insulin to have a good sugar control, they may have a good control by taking lesser doses of insulin, and that's how the exercise like physical activity, like a simple walking, can give a good blood sugar control to our patients. Now, third thing is, exercise is also known to bring down the complication rate in our diabetic patients. Scientific evidences have proven that the diabetic patients who have a cardiovascular complications, that is like heart problems, or the renal complications, that is like kidney problems, it has been shown when they take their routine medication, now it is clubbed with the exercise or simple physical activity, the rate of complication or the progression of the complication can also be slowed down. Thank you.